Sign and symptoms of pertussis disease or whooping cough. As we know that this disease is a bacterial in origin and is very contagious, and it was very deadly, especially for the infants. But in this modern period, with the advent of vaccines, the morbidity and the mortality rate has been reduced to the significant low level. For the diagnosis of this disease, initial history of the patient of the whooping cough and the other symptoms of the disease. In addition to this, healthcare provider will examine the physical findings in the patient and the imaging tests are performed: X-ray chest, CT scan, complete blood picture, count picture, in which there is leukocytosis, raised ESR level, there is presence of antibody to the bacteria, and the more specific and certified test is the PCR test. These are the basic diagnostic steps taken before the treatment to be started. According to the symptoms of this pertussis disease, that has been divided into three phases. First phase is called catarrhal phase. In this phase, there is rhinorrhea, stuffiness of the nose, low-grade fever, diarrhea, headache, anorexia, malaise. There is congestion of the conjunctiva and subcutaneous capillary hemorrhages. This phase is very contagious, infective, because in this phase we can perform the diagnosis test of the culture and sensitivity test, that is presence of bacteremia in the blood can be detected, and the start of the antibiotic treatment is useful in this stage. Next is called the typical and the classical phase of this pertussis disease is paroxysmal stage, in which there is a typical whooping cough, in which there is gasping and hacking sounds of the respiration is produced, especially at the end of the inspiration. Repeated episode or the fits of the cough, severe cough, which is very distressing, very painful and dangerous one, and that is called as bone-breaking cough. Due to this, certain complication may happen, because repeated attacks of paroxysmal cough leads to the alveoli to be devoid of air. The air is absolutely absent in the alveoli in this disease, due to which there is production of apnea, cyanosis, cerebral encephalopathy, seizures, and the various capillary hemorrhages in the body. This phase is absolutely non-infective, because the spread of the disease occurs in the first phase.